The MRC Laboratories, the Gambia, is today the UK's largest investment in medical research in a developing country. The unit's research, from its inception, focuses on infectious diseases and nutritional problems of immediate concern to the Gambia, with the aim of reducing the burden of illness and death in the country and the developing world. MRC research activities in the Gambia have developed over the 75 years to position as an international center of excellence in research and training, preceding most of the country's other institutional structures. The events that led to the creation of the MRC laboratories and largely determined the unit's initial research program began 17 years earlier. In 1936, an advisory committee on nutrition in the colonial empire was set up at the request of the Secretary of State of the British colonies to consider comments on health and nutrition within their respective territories. The committee recommended the creation of research in field studies on diet, health and physique in different colonial territories to be supported by the Colonial Development Fund. The Fajara Human Nutrition Unit was proposed to represent a field research station in a colonial territory by the Advisory Committee on Nutrition, and this was supported by the Research Council. In early 1947, Dr. Benjamin Stanley Platt, who was then director of the MRC Human Nutritional Research Unit at the London School of Hygiene and Tropical Medicine LSHTM, and a principal advisor on nutrition to the Colonial Office, recruited Dr. W.T.C. Berry to lead a nutritional field working party at Ginyari in the Central River Division of the Gambia Protectorate. About 100 miles away, at Fajara on the Atlantic coast, Dr. Platt established research laboratories on what had been the site of the 55th British Military Hospital. He purchased the German airline Lufthansa House, which was used to house flight crews, for housing clinical and laboratory staff. Besides the house and also overlooking the sea was a bungalow that was going to become the director's house. A 16-bed research ward was opened in 1948, and Miss Margaret Lang from Queen Square Nation Hospital in the UK became the first matron. Mrs. Anne Lussac was employed as the first Gambian nursing sister. The initially built laboratory and clinic to support research on diets and nutrition rapidly started identifying and assessing the importance of endemic diseases in terms of their impact on health, and in suggesting new lines of research into factors influencing nutritional status. As research under Dr. Platt grew with the increase in staff and funding, the Colonial Medical Research Committee, on a review visit in 1953, recommended that the laboratories should conduct a wider scope of research into tropical medicine affecting the colonial territories. The laboratories then became directly administered by the British Research Council, and Dr. John Newsom, the director of the London School of Hygiene and Tropical Medicine Bilharzia Research Group, was appointed director of the newly founded MRC laboratories. During this time, Dr. Ian McGregor, who was recruited by Dr. Platt in 1949, had established a set of village-based studies in Keneba, Manduar, Jali and Katongkunda, investigating the relationship between parasitism and nutrition. Dr. Newsom was succeeded the following year in 1954 by Professor Ian as director of the MRC. Over the following 30 years, McGregor's group studied patterns of growth and survival within communities and defined the prevalence and importance of various communicable diseases, notably malaria, filariasis, hookworm and intestinal helminthiasis, yellow fever, measles, whooping cough, and non-communicable diseases such as hypertension, anemia, and malnutrition. Prominent among these studies was the recognition in 1964 of the role of antibodies in protection against malaria for the first time, and the effects of malaria on birth weight and child growth. McGregor's basic immunological observations laid a solid foundation for our understanding of acquired immunity today. By this time, trachoma research had also been introduced in 1956 by Dr. Leslie Collier, director of the MRC Trachoma Research Group. The broader program of research made the Council consider the hospital in Fajara and the Bush station in Kenneba essential assets of high potential value. McGregor's work in the 1950s showed that barely less than half of the children born in Kenneba survived to their 5th birthday. The horrors of the measles outbreak in 1961, for instance, killed a quarter of the children. Another highlight during McGregor's directorship was the launch of Lady Dale, a laboratory ship on the River Gambia donated by Sir Henry Dale, the then chairman of the Wellcome Trust and the trustees in London in 1958. Dr. Ian McGregor returned to Britain after 20 years and Dr. Bray was appointed director. In 1974, Professor Roger Whitehead, recently evacuated from the MRC unit in Uganda due to insecurity fueled by Idi Amin, expanded the nutrition research in Kenneba and with postdoctorates Anne and Andrew Prentice, conducted seminal trials of maternal supplementation to improve birth outcomes and lactational performance. The role of early childhood infections and of persistent gut damage in limiting child growth was also established. In 1978, Ian McGregor returned to fill in as interim director. Dr. Brian Greenwood got appointed as director in 1980. Dr. Greenwood arrived from Ahmadu Bello University, Zaria, Nigeria, with Dr. Hilton Whittle, a virologist, and a Sierra Leonean biologist, Hassan Musa King. Brian established a new program of work with an emphasis on intervention studies against important local infections such as malaria, schistosomiasis, and hepatitis B. 2 new field stations were established to support such studies, whilst the scientific direction of the Kenneba field station was taken over by the main MRC Dunn Nutrition Unit in Cambridge. The newly opened stations were Basse Field Station in 1982 and Farafenni Field Station in 1983. The Farafenni field site in the North Bank Division was chosen for community studies on the prevention of malaria, and Basse in the Upper River Division as a focus for studies on schistosomiasis or bilharzia. With the increasing development of communication during this era, such as road transport, telephones and computers, which facilitated the strengthening of partnerships, MRC collaborated with the Ministry of Health of the Gambia to evaluate the Gambia's primary healthcare program, particularly in ways in which this program could contribute to malaria control, that is, on chemo prevention and implementation of insecticide-treated bed nets. Pioneers of these control efforts were Drs. Brian Greenwood, Joan Bradley, Bob Snow, Pedro Alonso, Kabir Cham, and Umberto D'Alessandro. In Basse, Dr. Andrew Wilkins and Dr. Hagen worked on the episodes of reinfection and treatment of schistosomiasis and showed the importance of antibody development in maintaining protective immunity in adults. In 1986, the Gambia Hepatitis Intervention Study was launched, which was the first large-scale vaccination project in the Gambia in which the introduction of national hepatitis B vaccination, or HBV, of young infants was carried out progressively over a 4-year period for the prevention of liver cancer. Following the hepatitis B vaccine trial, the Haemophilus influenzae type B, or HIB, conjugate vaccine trial was carried out under the direction of Kim Mulholland. This trial was based on detailed results of epidemiological and clinical patient studies that showed pneumococcus and Hib were the most important causes of pneumonia and meningitis in children in the Gambia. Also in 1986, an HIV research program started when it was apparent the infection was posing a major threat to Africa. Andrew Wilkins and Hilton Whittle established the program when AIDS cases were being diagnosed at the MRC clinic. Epidemiological studies showed an unusually higher prevalence of HIV-2 infection than HIV-1 in the country, and that many of these infections have been acquired in Guinea-Bissau, which is the epicenter of the HIV-2 epidemic. In 1988, MRC then established a new field site in the Guinea-Bissau village of Kayo in collaboration with Dr. Peter Abbey of Staten Serum Institute and the Health Ministry of Guinea-Bissau. The biannual surveillance and survival analyses in the Kayo HIV-2 community cohort and the case control studies at the MRC Fajara clinical cohort enabled the description of clinical, immunological and virological features of HIV-2 infection as compared to HIV-1 infections. It is through these studies that it was found that HIV-2 infection is of a lesser progressive disease than HIV-1 and elicits better qualitative protective responses even though HIV-2 does not protect against HIV-1 infection. By the early 90s, the unit's training role was expanded and courses for Gambian field and laboratory staff were established. In 1994, the unit became an affiliated research center with the Open University of the UK, which enabled local staff to take higher degrees while continuing to work in the Gambia. This was an important development, as West African scientists and technicians have an increasingly important role in the unit's scientific activities. From this time to date, the unit offered research skills and academic training for Africans that resulted in many well-qualified scientists with MSc and PhD degrees. Some of these have positioned themselves in international research and academic spaces either within the unit or abroad. As the partnership of MRC with the Gambia government continued to grow from strength to strength, some staff from the Gambian Government Ministry of Health were included in such training opportunities. In 1995, Professor Keith McAdam took over from Professor Greenwood as director of the unit. Professor McAdam introduced TB and non-communicable disease research into diabetes and hypertension, which he headed, and reproductive health, which was headed by Dr. Guys Walraven. These were in addition to the existing research program that included HIV/AIDS headed by Hilton Whittle, malaria by Margaret Pinder, and pneumococcus and hemophilus by Richard Adegbola. This program was underpinned by laboratory science or bench, epidemiology or bush, and clinical research or bed. In 1997, one striking research output was the analysis of data kept from 1949 to this date in Keneba that showed season of birth predicts adult mortality in rural Gambia. The seminal study of births and deaths in 3 Gambian villages dating back to 1949 demonstrated that people born during the annual hungry season are up to 10 times more likely to die prematurely in young adulthood. More recent research has shown that the mother's diet at the time she conceives a baby has a profound effect on programming the baby's epigenome with lifelong consequences. In 2004, Professor Tumani Kora was appointed director of the unit. Beginning of this period saw major intervention studies carried out by the unit, which had a subsequent impact in saving lives in developing countries. The cluster randomized study of flies and eyes, led by Dr. Robin Bailey and Professor Maybe, showed a reduction of trachoma prevalence flies where controlled with insecticides. This study and many subsequent interventions of the strategy known as SAFE, or surgery for advanced diseases, antibiotics to clear Chlamydia trachomatis infection, facial cleanliness, and environmental improvement to reduce transmission, in 2021 earned the Gambia the second country after Ghana to have eliminated trachoma. Thus, the people of the Gambia would no longer have their sight threatened by this potentially blinding disease. In 2005, two major milestones in intervention studies were achieved, namely the successful completion of the pneumococcal vaccine trial in Basse and the elimination of Haemophilus influenza type B or Hib disease in the Gambia, following the incorporation of the vaccine into the Gambia's Extended Program of Immunization (EPI). In 2008, the unit went through a radical change in its funding support, as it was required through a business plan to operate on a project-based funding model which would entirely depend on the attraction of external grants for its research, whilst MRC UK funds its platform support. This research program would run under research themes, namely vaccinology, headed by Professor Beata Kampmann, disease control and elimination by Professor Umberto D'Alessandro, and child survival by Dr. Stephen Howe. A West African platform to enhance sub-regional research collaboration was created and headed by Dr. Asan J. In 2012, Professor Umberto D'Alessandro was appointed as director of the unit. The vaccinology theme changed its name to Vaccine and Immunity. The child survival theme was absorbed by the disease control and elimination theme, while the nutrition unit in Keneba became the third theme, led by Professor Andrew Prentice. Two cross-cutting themes were created: maternal and neonatal health and West Africa. During this time, the unit engaged in varied research collaborations and increased its clinical trials portfolio on several interventions against diseases of public health importance. Highlights of some studies amongst others are: in 2014, the Global Enteric Multi-Center Study, or GEMS, was the largest study ever conducted on diarrheal diseases in developing countries. GEMS discovered the leading pathogens causing moderate to severe diarrhea, or MSD, prompting the call for a rotavirus vaccine in developing countries. In 2015, a cluster randomized trial on the combination of insecticide indoor residual spraying and long-lasting insecticidal nets (LLIN) was shown to be no more effective in cutting malaria than LLIN alone. In 2017, a double-blind trial showed azithromycin in labor lowers clinical infections in mothers and newborns. This trial, called Pregnancy, was aimed at addressing a global health priority: maternal and neonatal health. 2018 saw the integration of MRC, the Gambia unit, into the London School of Hygiene and Tropical Medicine in London. With its long history of quality research, its international recognition, and its contribution to health interventions in leading research to save lives and improve health across the developing world, the unit would now be best positioned in an academic institution to also contribute to global and public health education. Of recent, in addition to the increased clinical interventions during this period, the unit also witnessed the increasing development of research facilities and support platforms. During its history, the MRC unit, the Gambia, evolved through different historical periods. It investigated various human infections and non-communicable diseases, which led to research interventions that impacted on the health of the Gambian people. The unit has also enjoyed a long and fruitful relationship with the Gambian government. Through a long-standing partnership with the Gambian people, it has established unparalleled goodwill with the local population that enabled the provision of high-quality healthcare, training, and employment opportunities. The President of the Republic of the Gambia, His Excellency Adama Barrow, honored MRC the Gambia during its 70th anniversary in 2018 with this statement: The contribution of this institution to the health of our nation throughout the years is difficult to quantify, but we know it has been immense. The research they have carried out has without doubt saved the lives of many Gambians and extended the lives of many more.